in just blood. And I'm like, hey man, are you shot? Are you hurt? And then he's like, I don't know. And then I look at him closer and he has bullet holes. He's wearing like a long sleeve black sweater and he just has bullet holes all over his sweater. And I'm just like, oh no. And then he's pale as a ghost. He faints. Luckily I scoop him up and I can't yell out gurney because they just brought it. So I just carry him to inside the emergency department, put him on the bed, and any trauma, we strip off the clothes, etc. At this point, the initial kid that I pulled out of the car, he's now intubated. Fluids are running. My colleagues are trying to stabilize him with one of the doctors, Dr. Villacorta, amazing physician. Luckily, he was there that night. Charge nurse is on the phone with a level 1 trauma hospital because we are not, saying like, you have a patient coming in. And I'm like, hey, well, you have 2 patients now coming in. Now we have 2 ambulances en route to us to take these people to this trauma center. Luckily, the patient I was working with, he was only shot in the shoulder and arm multiple times. Few inches, it was his left arm. So a few more inches to the right, he would have been his heart, but he got very lucky. I stabilized him, gave him pain medicine, gave him like anti-nausea medicine, gave him some fluids. He was fine. The other kid, we didn't find out until later. Unfortunately, he did not make it. And
that was the brain.
Yeah. And so the reason that story stands out to me the most is we see gunshot wounds all the time. We see all of this occurring, all this gang violence occurring all the time. 20 minutes later, I'm standing around at the nurse's station. We're all debriefing a little bit, and I wear this jacket at work, and I have inside pockets. On the right side, I always have a trauma tourniquet and IV start supplies. And the left side is always like gum, snacks, because we never know when we're going to eat. And so I'm like, I want a piece of gum. I like to chew gum. And so I reach into my pocket and I feel something squishy. And I pull it out and I'm holding a piece of this kid's brain in my hand, about that big.
Why was it in your pocket?
When I pulled him out, it must have fallen in.
It fell in your pocket?
Yeah. And I'm just like, how is this my job? Like, how is this what I do for a living? Because now I'm like, what do I do with this? Like, I put a biohazard bag, send it off to lab. It's now evidence. But